As COVID-19 hospitalizations and deaths go down across New York,
now we're seeing it gradually decline.
There's still an ongoing debate about how warm weather will affect the virus.
The virus is dying at a much more rapid pace, just from exposure to higher temperatures and just from exposure to humidity.
Higher humidity and warmer temperatures appear to make the virus less stable. The small virus-bearing droplets sent into the air by a cough or sneeze seem more likely to attract water vapor, become heavier, and drop out of the air before infecting someone else. The opposite occurs during colder, drier conditions. The droplets are lighter and stay airborne for longer. But a recent Harvard study looked deeper into the spread of COVID-19. Dr. Stephen Kissler led the research.
We used a mathematical model to try to understand sort of how much seasonal variation there is in the transmission of these other coronaviruses that cause the common cold. And we also incorporated what we know about how long immunity lasts to these coronaviruses. Summertime weather won't be enough to keep the number of cases down low enough for our hospital systems to basically keep up, it seems.
Comparing their model with seasonal variations of the flu helps them to determine how the novel coronavirus will respond over time and how to plan for it.
And of course, you don't take into account that once a vaccine or some kind of medication or treatment comes into play, that can also alter the effects in the research.
Yes, since we don't have a vaccine or treatment available yet, we were sort of trying to look at what's the scenario if those things fail.
In terms of the second wave, and then the third wave, because they talk about, what's happening in the fall beyond summer months. What do you see in that regard?
There's a very high likelihood of another wave of infection, probably a substantial one in the fall. We've seen that in both the 1918 flu pandemic, which was really severe, but also in 2009. Most of the infections happened in the fall. I think we're going to have to pay close attention to what happens in the southern hemisphere because they're going through their winter right now. So in theory, the conditions should be perfect down there for the spread of illness.
In the meantime, as we look to soak up the sun and take advantage of the warm temperatures ahead, following the mandated safety guidelines will bring us closer to flattening the curve. For Pix 11 News, I'm Stacey Ann Gooden.